morning. My name is Asia. I'm a student nurse. I'm going to be working with you today.
My name's Kimberly. I'm also a student nurse.
And I'm Margaret, and I am also a student nurse.
So today we're going to be educating you and your parents on trach care. So we're going to suction your trach. We're going to change out your ties, and then we're going to what else are we doing? I think that's pretty much it. We're going to change your ties, suction you, and clean out your tube for you.
Yep, and we're just going to go through that step-by-step process explaining to you and your parents so that you guys are aware. You can jump in and ask any questions if you don't understand something, and we're going to be really thorough with you guys, okay? All right, so first we're going to start out with some sterile suctioning.
Yep. Do you have any questions before we get started? All right, we're going to go ahead and get started.
And before we start, can I just confirm your name and date of birth on the ID band? Yep.
My name is
Right.
Stephanie Miller.
No allergies. All right.
Okay, so we will clean the table, make sure, because we're having a sterile procedure. So then we'll open. And before I do this, I will turn my machine on. So the suctioning is going.
So this here is a sterile procedure. So what she's doing is you have to be very careful not to touch anything that's sterile. When you pick up your gloves, you want to pinch the edge of the glove and slide your hand in very carefully, trying not to touch anything. And then with your other hand, you want to place your fingers under the cuff and slide your hand into the glove. That way you're not contaminating the glove at all.
Yep, and after you have the gloves on, you can just kind of go like this. You don't want to touch anything, and you want to keep your hands above your waist at all times, just to make sure you're not contaminating going like this at all. So
Perfect.
So then I will grab the catheter. And I will get into position.
yep, and here we're going to go ahead and use a partner just with this specific kit, so she doesn't have to touch anything with her sterile gloves. I'm going to go ahead and pour some normal saline into this, and now this is just going to be used as a lubricant for the tubing, just to
Kind of help clear it. Yeah.
help clear it. It's easier on the patient.
So then this, being a sterile hand, is going to become my dirty or clean hand grabbing the tube.
And so the moment she does that, she cannot remove that hand from that spot.
So then I'm going to suction a little bit of the water. Then just being careful. I'm going to tell you that I'm going to stick it in.
And so let her know.
And I will go in until I feel resistance or until the patient coughs.
I'm going to go ahead and apply my oxygen.
And give her 30 to 60 seconds to catch her breath, to regroup, and so we're going to do it again.
Yeah, and so you insert until you feel resistance or until she coughs, like she said, and then when you're pulling out, you're gonna do this with your thumb on the suction to create that suction
like
while you're
this.
going up.
And you don't want to do it more than 3 times, so let's do it one more time.
And never go over 10 seconds at a time while you're inserting. And like we said, I think they are going to provide you with a pull socks on your way out. This is just, you can put this on before you start the procedure. It just helps you keep track of what her oxygen percentage is at. You want it to be in the 90 to 100 range generally. So.
And now I am done with suctioning, so I will just do this and turn off the machine.
Now she's finishing that, I've cleaned my table, so I can go ahead and open up my kit. In this kit here, I'm just going to clean out the inner tube inside of the trach. So I'm going to open my kit. process, I'm gonna apply my gloves.
It's always good for both parents to be in the room together doing these cares because it's easier than you think to break a sterile field. So having another person in the room to watch is always good.
Okay, I have my gloves on. Now I'm gonna apply this drape here. And this is just to protect so there's no kind of drainage dropping over her. I'm just gonna drop this on her chest. And we have that there. And then also in my kit I have hydrogen peroxide. And with this kit you want to, I'm gonna take this off completely if possible. That way I can place some things on top of here since it's sterile. I have my gauze that I'm gonna use to clean and change out the split gauze that's around her trach. It's a lot in this kit. So you wanna do half and half, 50% normal saline and 50% hydrogen peroxide.
Yeah, and so with this one, you just want to do the 50% peroxide into that one and in the water and then just leave the.
Yep, so I'll put just normal saline in this side.
You can leave that cap on, I think. Or off. Sorry.
I just don't want to sit on anything.
Oh, yeah.
So then, yeah, that's gonna run over. Doesn't give you a lot of room here. And it doesn't give you an exact measurement, so you have to kind of eye measure the 50-50. And then drop into this trash. Okay, so I am going to remove inner tube possible, and this is now my clean hand. There we are.
So now while she's holding that, she has to keep that in her same hand. You cannot switch over to the other one because it will contaminate her other sterile hand.
So I'm just gonna run this brush through here and get out any gunk or junk that's in there. Kind of clean that off. Gonna rinse it.
Yep, and then when you're done, she's gonna go ahead and shake it like that just to make sure, because we don't want water going down into her lungs after we put that back in.
Try and get as much out as possible. It's not gonna be 100% clear, but I do our best. And then we're gonna put the tube back in there. It's a little challenging, but don't be scared. It'll go back in nice and smooth. Then you wanna lock it into place, and the way you do that is you just twist it. And you snug on it just a little bit. And then now we'll start the cleaning process.
Yep. So now we're gonna change the trach ties and the gauze pads and clean the inside.
And you want to be sure you have 2 people at all times when you do this procedure for sure.
Here, let me go ahead and get this open.
So I am going to lift this first tie. And as you can see, I'm no longer sterile, so I've already cleaned the inside, so now we can go ahead and just start changing out the gauze. And with this hand, I am going to hydrogen peroxide and saline.
And then I'll be holding this in place.
And I'm going to start on the outside of it. Gotta kind of clean around there, get any kind of gunk you can off of it. And then we'll toss that. We're going to do that again. This time I'm going to go down and around. You don't want to go all the way around. You just want to kind of clean around the stoma as much as possible.
And that stoma is going to be the opening where her skin's at, and you're just going to want to make sure you don't actually go inside of the stoma.
Correct. Got it. And then I'm going to pat dry that on my 4x4s.
I'm going to go ahead and toss this trach tie because it's soiled.
Just gonna pat dry around the skin, that way we won't have any skin irritation. I'm gonna get that side for him while I help
Yeah,
this.
and while you're doing this, it's also good to like just really look at her skin and just see the integrity of it. Is it red? Is it draining a strange color? Does it have like a strange odor to it? And we'll explain like the signs after all of this of infection or anything that could be going wrong.
And this here split gauze, this one goes around the trach. I'm just gonna slide that under there. Do you have any questions at all while we're doing this? No?
Alright, good job, Stephanie. You're doing good.
Alright,
Oh,
so
we gotta,
this end here, there's Velcro on that. I'm just
Here,
gonna
let's look
slide
at-
that.
sorry, did you put it in weird?
I'm gonna slide it. There's a little opening here on the side of the trach. And I'll slide that in there. And then you just kind of fold it down there. And get it open.
It's like sticking to this.
Just pull this out a little bit. Kind of sticks to the gauze if you do the gauze first. Yeah. You want to make sure you leave enough room, so make sure it's not too tight. You want to get at least 1 to 2 fingers under there, a little loosely, not too snug. So that's plenty of room. There we go. And then after that, we can remove this. We have everything put off. Trash. I'm gonna remove my gloves. And wash my hands. And then we'll just monitor her breathing and see how she's doing and keep watching for any more drainage or sputum that might come up.
Yep, and anytime you're doing any of these procedures, she should always be sitting up. She should never be lying flat. And we also have just a little pamphlet here just with important things to remember and what to contact your healthcare provider with if something seems off. So we talked about the importance of the sterile field. We really want to make sure we keep our hands above the waist and not touching anything.
You never want to walk away from your sterile field either. That's another reason why you want a second person. If you forget anything or you contaminate it, you want to start the process over.
Yep, and it's okay if you contaminate. You need to just take a breath and start over. It happens to everybody. And then we want to make sure that before any of these procedures, we are thoroughly hand washing. That's just a basic infection control precaution to take that you should always be taking. Always have a second person. We said that. Upright position of your daughter during cares. If your daughter has any obvious discomfort during suctioning, stop immediately. Let her breathe. And like we said, only suction for a maximum of 10 seconds, and you can only go back into suction a max amount of 3 times. In between those periods, it should be about 30 to 60 seconds so that she can catch her breath. And always have a new packaged trach nearby in case of emergencies. That means even when you're going out to eat, like anywhere that you go, you should always have one in case an emergency happens. And then we have a list of what you should contact your healthcare provider if these happen. First of all, if you have any questions that we personally can't answer, if you don't have anyone to help you change her trach ties, you can call. If she has a fever, she's coughing, or has a change in normal breathing pattern, if her mucus is discolored or has an odor. So typically, like red coloring of mucus, let's say like yellow, like
Darkish
dark,
yellow.
like green, that can be a sign of infection. So you just want to watch for that, and the amount of the drainage, you want to just look at that. The skin around her tube is red or tender or weeping. So like we said, when we're changing the pads, we just want to really look at that and see what that skin looks like and just look close. And then you can also call if you need to replace her tube with a smaller size if you think that's needed. And we'll go ahead and give you this pamphlet on your way home. Do you have any questions for us right now?
If not, we provided a phone number you can call as well, and we can help you with any other questions. And if we can't help you personally, like she said, we'll get you a number that can.
Yep, and we're always here to help. This is a really tough thing for anybody to go through, so we're always just a phone call away.